A periprosthetic joint infection is one of the most feared complications in orthopedic surgery, and antibiotics alone are not enough all the time. And here's why. Periprosthetic joint infections, or PJIs, are infections that occur around joint replacements like hip, knee, and shoulder replacements. These infections are different and much harder to treat than routine surgical infections. The reason are the implants. Bacteria love metal surfaces. Once they attach, they form something called a biofilm, a protective layer that shields them from both antibiotics and the immune system. Inside the biofilm, bacteria can survive even with the stronger antibiotics. That's why treating a PJI isn't just about picking one drug, but requires multiple approaches for treatment. First, we identify the organism. Common causes include Staph aureus, Staph epidermidis, MRSA, Staphylococcus gram-negative bacteria, and sometimes multiple organisms all at once. Infections are categorized into acute and chronic. Acute infection usually resolves with antibiotics and possible surgical washout, but chronic infections and formation of biofilm over an implant usually requires removal of the implant with antibiotics. Some antibiotics will work well in the bloodstream but don't penetrate the biofilm. Others, like rifampin, specifically used because they help break down biofilm, which usually is combined with other antibiotics. So once we have this type of an infection, we have multiple options to treat it. However, we also have the option of antibiotic impregnated cement. Those infections can be treated with cement that is mixed with antibiotics and we implant it into the wound. Then the antibiotics seep out slowly over time and we eventually have to remove those beads. But those are different type of treatment options for different type of infections.